Well, believe it or not, this month marks the 3-year anniversary of when the World Health Organization declared COVID-19 a pandemic, turning the world upside down. While public health officials note variants of the original virus continue to circulate, for most of us, life in 2023 has returned to normal. But on this third anniversary, many are asking, what have we learned in the intervening years, and how can we rebound from the toll COVID-19 took on our mental health? Joining me now to offer his thoughts on these timely topics is Regents Blue Shield of Idaho Executive Medical Director, Dr. Daniel Meltzer. Doctor, thanks for being here.
My pleasure.
Okay, so first question, would you say there's any sort of consensus within the medical community as to where we are now with COVID-19, especially with the federal public health emergency set to expire in less than 2 months?
Yeah, so, COVID-19 is still very much a communicable viral illness we have to contend with. There are about 250 Americans dying every day from COVID. The Omicron variant is still lingering. However, we are and have been in a period of relatively lower rates of transmissions. Vaccines, boosters, antiviral treatments, exposure have really all helped to mitigate the severity and really the frequency to some extent that we're seeing in terms of COVID-19 infections. We're in somewhat of a steady state. So I think the reality is that it's what we're calling a permanently established infection. It's going to require consistent vigilance and vaccination. And having said that, we are certainly seeing some temperance in the severity and the frequency of infections.
Okay, that all makes sense. Now, of course, one big change driven by the pandemic was the expansion of telehealth, and that's the ability to see medical providers from home or really anywhere using phones, tablets, or laptops. So should we expect that will ramp down now that the public health emergency declaration is going to be expiring?
Yeah, as you said, the pandemic really prevented a lot of people from visiting healthcare professionals. That was the bad news. The good news really is that we saw digitally enabled care or telehealth becoming much more widely adopted, both in terms of the number of users and really sort of the technology, if you will, that enabled it. In particular, we saw massive upticks in behavioral health being accessed and managed vis-a-vis telehealth. At Regents alone, for example, we saw about an 8 times increase just in 2019 to 2021 for behavioral health conditions being treated in telehealth. I think the reality is that the convenience, the fidelity of some of the technology, as well as the nature of Idaho, which has some geographic challenges, I think we'll see telehealth here to stay.
Yeah, okay, that all makes sense too. So let's stay with that mental health aspect of the pandemic, because obviously during the brunt of it, we all learned a lot about ourselves and others. So what would you say are a couple of the key lessons that we learned during the pandemic?
Yeah, I think what you were hinting at, the other pandemic, if you will, was really the rise in behavioral health challenges that so many people experienced. I think the good news is that there's less stigma now than I think there had been in terms of identifying and managing behavioral health illnesses. And there's many more ways of dealing with them, as we talk about with behavioral health. The other piece is that really I think we began to understand even more and value the importance of being connected. Feelings of isolation, feelings of loneliness really were exacerbated by the pandemic, and that's bad for our health. We're social by nature. So the good news is we've learned to maintain some connections from telehealth and from virtual means, but I think we've also really come to value those face-to-face interactions that we're able to have.
Yeah, absolutely. Hopefully we all learned a lot and taken something good out of it, if anything. All right, we are just about out of time, so joining me today has been Regents Blue Shield of Idaho Executive Medical Director, Dr. Daniel Meltzer. Doctor, as always, thanks for being here.
Thank you.